To the chair, the esteemed members of this committee, my friends, associates, family members call me KDRG. I am the founder and chief organizer of Liberty Action Council. I graduated from the Cushy Institute with degrees in Eastern Medicine, Oriental Medicine, and Acupuncture. I am a degreed and certified holistic health and well-being practitioner, and I run a spiritual and holistic health and well-being retreat center in Ohio. And I am here today to offer my testimony in support of HB 248, including the sub-bill 248. This bill goes a long way to prevent any violation of our God-given inalienable rights. And I want to make a correction. The Constitution does not give us our rights. We have inalienable rights given to us by God that are elucidated in the Constitution having been established to protect those rights against big government and against the majority that might seek to influence or oppress the minority. Conscience is key. When you hear me say bodily autonomy, conscience is synonymous. Conscience is not only a spiritual principle, but a sacred law. It's my connection to God. And if conscience is violated, meaning if bodily autonomy is violated, they're indelibly connected. Just hold that thought, please. So this is a freedom bill to regain the rights that have been stripped away from us, frankly, prior to and during the pandemic, including sections of the Ohio Revised Code passed in opposition to our Constitution, and to ensure that our God-given inalienable rights, elucidated in the Constitution, and our statutory civil rights are protected. Also protected, by the way, under the Nuremberg Code, so that these are maintained and sustained now and for future generations. I want you to remember 3 dates as I finish my testimony. September 21st, 1939, March 23rd, 1965, May 28th, 2021. History has repeatedly shown us that regulation without liability is no regulation at all. It's in fact a dictatorship that allows the corruption of greed to run rampant, leading to tyranny and fascism. Corporations do not have God-given inalienable rights, only individuals do. And with the passage of H.R. 5546, the National Childhood Vaccine Injury Act of 1986, as we have heard today, vaccine manufacturers are indemnified of all liability from harm caused by their product. Now, this has allowed a medical industrial complex to evolve in our state and country. I want to be clear. Not all medicine falls under the hub of the medical industrial complex. However, we have a growing, expanding, out of control medical industrial complex in this country, run by the B&B, does not mean bed and breakfast, bureaucrats and billionaires, where the sacred doctor, healthcare practitioner, patient relationship has been castrated by public-private partnerships designed to remove what remains of our constitutional right to bodily autonomy by destroying that very relationship in a way that now makes businesses agents of the government in securing this medical industrial complex, this business model for which is profits before people. Now, this is no more evident in what we are witnessing now with government and the private sector pressuring citizens to take an experimental drug, and doctors who have already treated the contagion successfully with inexpensive, effective alternatives to COVID shots, who have been repeatedly censored and threatened with license revocation, and some of them jailed, all for protecting the bodily autonomy of the patient while following their own Hippocratic oath. We find ourselves in a situation now with the need to protect the rights of those in our society who refuse vaccination. If this vaccine becomes the greatest thing on the planet, which it very may will, I don't deny that. Still, I want the right to choose whether to put it in my body or not. It doesn't matter if it's the greatest vaccine on the planet. Does not matter. To force it on me in any way, meaning I can't take a job and hold my job and maintain my conscience with my Lord, This means that we allow government to interfere with conscience, to interfere with bodily autonomy. This is all this is about. This is all this bill is about. It's not about anything else. If we allow government to interfere with the individual's conscience, USA, United States of China, or Russia, or any other company that employs the attack on conscience, we find ourselves in the same situation. Many of our rights were stripped away from us during the pandemic states of emergency. I've heard today, Representative West also brought it up, hasn't happened yet. As citizens of the Republic, we each have a duty to act as sentinels, to sound the alarm when the foe is off in the distance and headed our way, not to wait until the foe is on our front doorstep when it is too late. I ask you to remember 3 dates. September 21st, 1939, of course, this is the date that the Nazis began herding Jews into ghettos under quarantine, proclaiming that Jewish people carried diseases that were deadly to all other citizens of Germany and therefore had to be quarantined. Not unlike the quarantines Governor DeWine had considered at one point last year under COVID and the lockdowns and segregation we have endured for the last 14 months. March 23rd, 1965, this was the date that my mother, while marching with Reverend Dr. Martin Luther King Jr. in Selma, was knocked to the ground by an Alabama state police officer and repeatedly beaten for demanding the right to vote. Such events can happen again here, unless we act now to fight the pandemic of growing discrimination and segregation that has been inoculated with the corruption of greed endeavored in by the B&B. My 3rd date, as of May 28, 2021, Alabama, Arizona, Arkansas, Florida, Georgia, Idaho, Indiana, Iowa, Montana, North Dakota, South Dakota, South Carolina, Texas, and Wyoming have all passed measures to ban vaccine passports. And as of this date, mainstream media is even reporting that 40 states are in the process of creating legislation that would ban vaccine requirements. Here's the thing. History has taught us that free societies are never guaranteed forever. History has taught us that free societies are never guaranteed forever. They must be fought for over and over again. This is the truth. Therefore, I ask you, unite us. Unite us. Republican, Democrat, black, white, red, tan. Unite us to protect our God-given inalienable rights. My right to choose conscience over everything else between me and my God, which is why we have these protections. Unite us. Pass this bill, HB 248. Thank you very much. I'll take any questions that you may have.
Mr. Esposito, thank you for your testimony. Where do you live?
Youngstown, Ohio. Yeah, I know.
What county? What county is that?
Mahoning County, Youngstown, Ohio.
You people are paying attention, aren't you? You knew where we were going with that. Pastor Bobby, I'm sorry, but we have someone new that wants to move to Warren County. He's going to bump you out. So we'll start the questioning with Ranking Member Russo.
Thank you, Chair Lips. Thank you for being here. I was actually surprised you said Youngstown. I was not expecting that.
Okay.
So, you know, I actually think my colleague, Representative Gunter, up here posed a very interesting question to a previous witness. And it was, you know, I think in government we're always, you know, this is the American story, always trying to understand, you know, where is that line between individual liberty and our responsibility to society and living in a civilized society. And so you talked a lot about conscience over everything else. And so my question for you is just kind of on the flip side of this, you know, where is the, you know, you're talking about the decision whether or not to get a vaccination, which again, you know, there is no state passport. I'll just remind everyone that vaccine passport. But on the flip side of this, I mean, where do we draw the line? Businesses want you to wear a shirt when you come in. They want you to wear shoes. This committee, actually last General Assembly, we required that daycare workers get a TB screening, which is, you put a material under your skin to test if you have a reaction to screen for TB. Seatbelts. I mean, we could go name a whole number. Yeah, we can name a whole number of things that, we have done in the interest of public safety, where individuals maybe, are consciously against wearing a seatbelt or consciously against texting while driving. We haven't passed that in Ohio, but other states have. Or consciously against getting a TB screen, or consciously against wearing shoes in a store, or consciously against looking at a computer all day long because it gives me headaches and it strains my eyes. Where does that line get drawn? I'm just curious, your thoughts on that.
We're not comparing apples to oranges, but let me start through the chair to Representative Russo. Yes, businesses in these kinds of situations, I would absolutely agree, have the right to choose to mandate those kinds of things, and if you don't like it, you can go work somewhere else. However, this is an experimental biologic that businesses already and universities already in Ohio are mandating that's going into the body. This is an entirely different story. And so to make businesses agents of the government and private industry, frankly, I think we have to begin to at least question. You bring up a very important point, which bears a lot more discussion that we have time with today. But let's look at Big Pharma. No indemnification whatsoever, cannot be sued, do not have to market. Let's look at their business model. Government markets for them. They don't have any marketing costs. Development costs, taxpayers pay about 40% of that. So when you have this beast in partnership with government, making people feel horribly frightened, but also guilty that if they're not taking an injection, they're somehow harming someone who has, leads us down a very slippery slope when we're talking about bodily autonomy, what we put into the body. It's got to stop somewhere. And I think we're at this point. It's this body, I really, in one way, would hate to be in your position. You have a defining decision to make, which is going to influence the course of history in this state for generations to come. So if we're talking about sneakers and shoes, okay. But what goes into the body, impacting perhaps my health today or 5 or 10 years or 20 years down the line from a biologic that's not being studied, entirely different story. You know, there was a hepatitis outbreak in New York City when I lived in New York City years ago. There was a huge reaction on the part of businesses. Understandably so. Hepatitis C is incredibly contagious. So employees, what are we going to do? What are we going to do with the employees? How do we know who has it, who doesn't? Should we mandate that they stay home? Should we fire them? And here's what actually happened. They said, speak with your doctor. If your doctor can on your behalf send a note saying that you're not contagious with Hep C, then we'll allow you to come back to work. One of the problems we have in this situation is we're destroying the sacred relationship between the doctor and the patient, between the doctor, the healthcare provider, and the patient. Anthony Fauci has not treated a single COVID-19 patient. Neither has, and I forget her name, who heads up the CDC currently, has not treated patients. I can give you a list of 175 doctors on the front lines right now who are treating patients with alternative COVID therapies, curing them of the actual virus. I would like to see this legislature bring them here for hearings. I can help you get them here. You need to hear from them because it's very difficult for us to understand the context of this, and I really appreciate your point, and it's a very important one, but it can't be discussed outside of the whole picture. When you're talking about bodily autonomy, When you're talking about the possibility that even if I feel great today, perhaps, we don't know, but I could be. That's the important thing. I could develop cancer 20 years down the road is sufficient enough for us to examine in this particular instance whether or not businesses should have the right to work hand in hand with all of these organizations, money is involved, to mandate vaccines, or a university, when it comes down to bodily autonomy, is something that I think we have to carefully look at, and to look at your statement, where do we draw the line, in the context of that big picture. Because it's not just sneakers and T-shirts.
So one quick follow-up. Just so that I understand your perspective on this, I mean, you talk about experimental biologics. Do you consider all vaccines experimental biologics, or just COVID-19 because of where it is in the approval process? I just want to understand where your thought is on that.
Yes, vaccines are experimental biologics in my mind. And let me tell you why. Not just to my research. There's no vaccine provider, and if you examine the patent documents, licensure documents, and I've read many, many of them, will ever guarantee, they don't say this vaccine cures or heals or prevents the flu. None of them say that. So by virtue of that alone, if we look at the manufacturer's statements filed with the FDA on any vaccine, none of them go as far to say as this is an absolute cure. Not only that, but there's a long list of side effects in these documents by their own admission. So yes, they're experimental. By nature, they're experimental. Not to say that they don't do any good, but because there can be damage, I have to have the right, under any circumstance and in any environment, to say no, precisely because there can be damage. Science is not perfect. It attempts to be, but it's not. Medical science is not perfect. Any science is not perfect. And one size does not fit all. This is the other thing that we have to understand. There are alternatives. Here in this state, we've got stockpiles and stockpiles of hydroxychloroquine that could have been distributed against the will of the FDA, because the state legislature has the right to overturn any federal policy in the state. Lives could have been saved. We've got blood on our hands. I include myself in this for not taking a stand sooner on the alternatives that I know that doctors are using to address the virus, not just clinically significant symptoms of COVID-19. There's a difference. So we've got to be very, very careful here. And your statement and your point is well taken. But again, we're talking about something, no vaccine has been proven not to have harmful side effects. None, zero, never been done. In fact, the opposite has been shown, particularly with people who already have underlying health conditions and diseases, compromised immune systems, that the vaccines don't work for all of them. We're painting a broad brush when we should be focused on what we did with cancer 20 years ago. Let's open the field, let's look at every single possible therapy that we can provide, and let's have all kinds of combinations of therapies. And let's see what works. And let's see that one therapy is going to work for one individual, but not for another. And we don't have that with the vaccine group speak and mentality that says the science is settled. It is not settled. It is not settled in the minds of professional researchers and practitioners and doctors, but that doesn't even matter. It's not settled in my mind. And so I want the right to say no. If you have the right to take a vaccine, I have the right to say no. That's the bottom line. That's the bottom line. I agree. You want to go get vaccinated with COVID shot today? Go do it. But if you have the right to say yes, I have the right to say no. Otherwise, we're not in a free society. And furthermore, the government has to draw the line between being concerned about people and making a decision on their behalf. It's my decision. To say I'm not going to get vaccinated, I'm going to take the risk of getting COVID is my decision, as well it should be. And if I get sick and I have an underlying condition and I die from it, that was my decision. That was my decision. Not that I heaped it on anyone else, but I was able to make that decision for myself. Or conversely, to take the vaccine.
Representative West.
Yes, I just got one statement, I guess. Well, first of all, I knew you was from Youngstown. You came up here clean. And that's the only way Youngstown rolls. And Representative Lips did not want you to go to his city because he was just admiring your tan. As you can see, his is getting a little deep there. But no, I got a question. So when we talk about natural medicine and those types of things, if the shoe was on the other foot and everybody was looking at natural medicine, would you carry the same stance?
Would I care?
Would you have the same position?
The position being, the same position?
Position being that individuals should not use natural medicine and should have that choice.
Yes, that they should have the choice of whether or not to. I'm sorry, through the chair to Representative West, that they should have the choice. If the shoe were on the other foot and there were group speak and governmental pressure and business pressure for people to only use natural alternative therapies, that's just as wrong, in my view.
And then just one more follow-up. And this has been egging me on for the whole session, all day actually. Freedoms, we're using that a lot.
Yes.
Freedom to choose. And I'm a strong believer in choice. I'm a strong believer in freedom to choose, especially when it deals with women, their choice in having an abortion or not having an abortion, or a woman or individual that needs a flu. But when it comes down to a virus that nobody knows about, we don't have all the answers. And what we do know is that people are dying. Then what is the alternative to that?
Through the chair to Representative West. In this pandemic, no toxicology teams were dispatched. No epidemiological teams were dispatched. We know that many of the people hospitalized with COVID-19 did not die of COVID-19. They died of underlying conditions that were exacerbated by it. So there is a lot that we don't know. In the first 3 or 4 months of a pandemic, absolutely we should take the ultimate precaution. But there's a lot that we do know about alternative therapies to address actually the virus that would mean that at 14 months out, we are no longer in a situation where that it's either or, if you know what I mean. We're not in that situation. It's a fine line to protect the public health, and we also know during states of an emergency like this, it's when rights are taken away. And as I said, I don't envy this body. You're in a position where you really have to kind of walk the fire of this fine line to protect freedoms while making sure that the public health is protected. However, we have not done our duty in this regard. We have not had hearings from doctors on the front lines about how they've been treating, in this case, the virus. There have not been hearings for the General Assembly here. We have not asked doctors to work together to talk to each other about how we can go about coming up with better, quick ways to treat the virus. We have not allowed for open public debate on the part of researchers due to censorship from big tech, among others. Yes, I think we should have tons of debate. We could have had it months ago. We could have had doctors working with other doctors in other countries, in this country, all getting together on Zoom, if necessary, speaking about comparing their findings. We haven't had this. And so the one thing that I have to respectfully disagree with is that we don't know a lot about the virus. SARS-CoV-2 is in the SARS family. It's 76% the same as SARS-CoV-1. We know a lot about SARS-CoV-1. So it's also in the coronavirus family. But I digress. The point is, if we allowed open debate, we got doctors together in this state, that I can help bring here, that I can help converse with each and every one of you. If we allow them to talk to each other and compare notes on their treatment of individuals, we would be much farther along and less embedded in a state of fear What do we do? What do we do to protect the public? There are doctors who are protecting the public health. They're doing it, but they're censored. They're not allowed to speak about it. Dr. Peter McCullough, Dr. Vladimir Zelenko, excuse me. And I've got a whole list. I posted a page. I hope Willa has it. It's got a URL to our website. There's a long list. None of those doctors are allowed to speak out. Their licenses have been threatened. They've gotten to the public by way of documentary films. Why? Why, in the greatest state in the nation, have we not said from day one, let's get all of the doctors on the front lines together and compare notes right away and can keep comparing notes and can continue to compare notes? That would be the way to do it. And then we suss out the question, are we really protecting the public health or not? I don't think we even know yet. Honestly, Representative West.
Representative Gross.
Chairman Lips to Mr. Esposito, thank you so much. I won't make you take an oath, but if I was to say, there is a prevailing thought that the only immunity that we can achieve in Ohio is through vaccination. That's unusual because it's never been the case. As a holistic practitioner, would you be willing, with your practice, which I want to come see, to take an oath that you for a fact know that there are other ways to achieve health and immunity from disease, whether it be COVID, measles, meningitis, other things, whatever you choose and how you answer, without vaccination?
To the chair, to Representative Gross. Do you have a Bible?
I do. It's on my phone.
To answer, yes, I would take that oath. Yes, that there are alternative therapies that would render for a good portion of the population that vaccines are unnecessary? Absolutely. Absolutely. I'd not only stake my reputation on it, I'd stake my life on it.
So would it, sir, be your proposition through your testimony that every Ohioan should be afforded the opportunity to choose any exemption from any vaccination suggested by any provider at any time?
Through the chair to Representative Gross, yes.
Thank you.
You mentioned you were going to visit his practice. I would like you to wait a few months till that's relocated to Warren County.
Butler County.
So just hang on and we'll let you know.
I have associates in Warren. I may be coming your way with some
There you go.
programs.
See?
Yeah.
There you go. I'm winning him over, West. I've about got him. Thank you, sir.
Thank you.
You did a tremendous job, but thank you very much. We appreciate your patience and certainly your expertise. So thank you for sharing with us
Thank you very
today.
much for hearing me.